Dr. Andrew to our podcast. How are you doing today?
Doing good, Brody. Thank you for having me on for today.
Yeah, I'm super glad to have you on and excited for this conversation, and especially how chiropractic care can influence our body, mind state, something that I'm really into. And a lot of our listeners are into how we can reduce stress and anxiety, sleep better, and overall feel better. But starting out, can you tell us a little bit more about your journey in becoming a chiropractic doctor and what inspired you originally to get into this profession?
So mine was a little bit of a late bloomer. So I come from a family of nurses, construction workers, a lot blue collar type areas. So I had affinity with healthcare from a very young. I was always an athlete. I always played sports, but I was very injury prone. That was my biggest hiccup. And most of the times it was like, oh, let's take you to the urgent care. They'll talk to you a few minutes. Here's a prescription of such and such. Be good. Then the next thing will be, okay, I finished the bottle. Went to play about maybe a few months later, same injury, same repeat, go out. And I thought that was the normalcy until I met a chiropractor when I was in undergrad. And he said, no, we can fix this up. You don't need to be on this pain medication. We need to fix your biomechanics and get everything back to work. So at that time, I was studying to be a kinesiology major, focus on biomechanics, do some research. But at the same time, I didn't really like what I wanted to do, and I was running out of time. And I had an uncle of mine who talked to me like saying, hey, you're smart, you know the human body, you know how to do all this stuff. Go check out my buddy who is also a chiropractor and show you how it's done. And I was about 26, and he pretty much showed me, and I'm like, okay, I'm going to sign up to Cleveland. Did a tour that following year, that was about 2018, and got enrolled that following fall onto that point. Then I graduated in 2021, opened up my own shop, and I've been helping a lot of cases in that point.
That's really cool. That it was kind of an interesting, like you said, a late bloomer's journey into that field. And when it comes to explaining like the philosophy of chiropractic care, and how would you explain like what how it's a little alternative in the sense that how would you explain it to somebody that wouldn't understand it? How would you explain that to like a new patient coming in to your practice?
Well, I like to start off by saying chiropractic is not about the popping, the snaps, the crackles, the back breaking. It's working on getting your nervous system to be front. And that's the first thing I want to talk about, because I focus most on the neurology, because the nervous system connects to every single facet of your body. And if we were able to control the nervous system, that's how we're able to get the results, get the health, whatever complaints that you're having. That's how we were able to resolve and figure out what we need to do specifically for what kind of pattern of discomfort the patient's going through. So mine is just being nice and easy, saying I am focusing on getting you from being on an unbalanced environment into a more balanced, healthy relationship with your mind and your body. Because we're basically in a seesaw effect. If we are in that seesaw and one side's more than the other, and we're not weighing what's going through there, it's just going to be chaos. And we don't want that big upside or downside. We just want little small things, because we live in a world that's going to be full of stress, either good or bad. It's figuring out how to be good with the good and let go with the bad.
That's a really great explanation, because it's all about the nervous system, right? Our overall nervous system. And if you think of the body like a car, you know, here that's our, I guess not our motor. I would say our motor is more of our brain or our heart, but the nervous system is like the mechanism that supports the rest of the body, right? Sending the messaging to the brain and back to the spine. So if there was like an analogy that you could come up with, like what is the spine's specific, if the body was a car, right? The body mind connection, what would the spine be?
So if the spine is, if we're talking about the spine, so to get your car to go, to have that communication, you got to have your wheels turn, right?
Mm-hmm.
So what's the thing that makes the wheels turn? Your transmission.
That's right.
So if your transmission is not working good, it's getting kinks and you're not getting in alignment, and everything else that's attached to the transmission is not being forego because the transmission is bad. What's that going to do to you, the rest of the car? You're going to have misfiring. Your wheels are going to go bad. Your brakes are going to go shot. Your shocks are not going to be good. And the most important thing is that your stabilizers are not going to keep your car above the ground.
Yeah, and I think that's so important for people these days to understand that if if any individual, especially vital part of our body mind connection is off, like then we're gonna have some big issues there. You know, like you said, the transmission shot. So we're you know, we really need to take care of our postures, take care of almost, I see the body stores trauma, if I'm not correct, you know? And so does cracking the spine and the synovial fluid, getting that moving better and flowing better, does that allow us to access and heal our trauma more efficiently?
To be honest, don't really have an exact answer for that. So what I kind of think about is that instead of that cracking motion and that synovial, I'm thinking about more stimulating the cord that's most connected to the brain. Because if we think about our vertebrae as similar as we treat our lungs, we treat our ribs, what do our ribs protect? It protects our lungs, it protects the spleen, the heart, and part of our liver for most important part. So if we have our vertebrae going from all the way to the top, the base of our head, all the way down to our tailbone with our spinal cord, and it's that heavily protected, that's what's keeping us going on to it. That's having the most communication, and that's where that intersection of that transmission that needs to keep rolling and going for us. So it's a little bit of everything, but it's just relieving and getting stimulation through that cord to help get that brain to say, we're good, we're functioning.
Okay. What role does breathing play in the functionality of the spine?
Oh, if let's say that you're a heavy chest breather, that you're just breathing upper lobes of your lungs, you're breathing right through your collarbone, your upper chest, you're putting more pressure on your upper neck and your upper back than you are for a lower. So you're causing more spasms going through that point. So all those nerves that are coming out of the spine and trying to innervate onto that point, you're going to cause them to be wrapped up in different tissues, tendons, ligaments, small muscle variants. You're going to have blood vessels that are supposed to be into there that are also innervated to not perform as well and not have that flow. So we're going to have a very difficult time breathing. We're going to have shallowness of breath. We're going to have a difficult time getting the most pure O2 oxygen out and the more consistent CO2 rate out, but also you're going to still intact toxins that you don't need to have in your body, but your body's trying to filter at a consistent basis.
That's a good segue for maybe speaking about the zone technique that I found and was very impressed upon. You talked about the different zones or the functionalities of the human body. Can you dive a little bit more into the zone technique?
Yep. So zone technique was developed by Dr. Thurman Fleet in the late 20s, early 30s in the chiropractic world. He discovered this by just seeing a multitude of patterns and accolades that he possibly had. He figured out that the brain has 6 centers that it has on itself to make it sure it's working. It's not like, oh, we need to know this, like our personality is in our frontal, temporal is memory, so on and so forth. He figured out that with our 6 systems, that it's a continuous loop in the brain, because every part of the brain is saying, hey, we need to go from here to here to here to keep circulatory system on right. We need to go to front to back to keep musculatory system to on bay. So it's a basis of trying to balance out all the systems and being highly specific, saying, okay, you're coming in for X, Y, and Z. Let me run a screen and see what it is onto that point. Then that gives me an idea of what pattern you're going through, what we need to do to treat that. And then it becomes very highly specific for the patient onto that point, because now we're taking guesswork. It's like saying, it's because there's an old saying that most chiropractors will say, I believe it's going to be this segment. Then you'll have another chiropractor say, no, I believe it's this segment. We take the guesswork out when you find the right pattern for that point. So now you're giving the patient the best service that you possibly can onto that point, and give them more advice saying, hey, you have a unbalanced digestive system. Whatever you're having to eat, I recommend that you limit it nice and slowly. Try to find something that substitute it, and we'll continue to work on this until you are feeling 100% well.
Yeah, and I see here about, like, the eliminative system, which we have to eliminate what we eat and what goes into our body, because we're really that's a big stressor these days, is a lot of outside stuff. We already talked about the nervous system, and you spoke about the digestive system. One I'm not as familiar with would be the glandular system. Can you speak a little bit about that?
Yep. So the glandular system, that's every single gland of your body onto there that's being affected. So that is everything that can be your pituitary gland, your salivation glands, your sweat glands, sebaceous glands, and specific genitalia for male and female onto that point. So it just raises, like saying, okay, if we're having a difficulty with males saying, okay, we're having difficulty with testosterone, we're having ED issues, we're having problem with urination, so on and so forth. That just gives us an idea of saying, oh, we need to focus on this pattern, but also correlate saying, if we need to get test levels done, we need to correlate this as well.
Yeah, very much so. The hormonal system, and how the pituitary, it secretes those hormones. But if that's off, we're not going to be feeling good. And so, yeah, like our body has these systems like almost like a car, like we were speaking about. What throughout your work and working with patients, what have been some like the more awe-inspiring like transformations that you've seen through working through chiropractic care?
So more inspiring I've had ladies who come in who have been saying, I have a history of diabetes, I can't get off of medication, I can't do this, I can't do that. In the last couple of months, they've said, I'm off insulin. We've been able to balance out that pancreas. We've been able to get them full form. They've been able to change their diet, been able to do what they need to do to exercise, control their stress work. And also the biggest thing is that they were feeling loved. It's healing is love, in my opinion.
Yeah.
Onto there. So there's been a couple of ways I have at that. Then I've had my most recent case is I had a lady who had 9 days of a migraine. and we got her fixed up in 2 visits. Everything was, it was a heavy nervous system overload and unbalancement with hormones, and we're saying, okay, let's get this settled, get this going done. I want you to increase your water intake, but I also want you to add a little bit of salt because of how much she was dehydrated. But also, 9 days with a migraine is not a fun deal. Most people can't survive by doing one day.
Yeah, for just speaking for myself, migraines can be all consuming to the point where you can't really focus on anything. And when your focus is off, you're in a lot of trouble. I would like to speak a little bit more about how chiropractic care could help with mental health issues such as like stress and anxiety. I know we kind of touched on some of the basics of chiropractic care, but more specifically, how could that influence our mental health?
Okay, so this is going to be, will be a little bit biased on this because I did suffer from mental health. Like, most medications I was taking was for anxiety, depression. I remember my mom taking me to all these specialists because when I was a kid, I had such a high anxiety as being in just a single digits that no one knew what was going on. Smart kid, but just absolutely afraid to do anything. So they put me on so much medication.
Mm-hmm.
And I never felt good about it. So getting treated by the couple chiropractors that I've had in my past, it has balanced out me, like saying, oh, we're taking all the stress away that will cause you to be very anxious, very depressed, get you better sleep that you have. Because now we're playing with getting those hormone receptors to say, oh, we can't have you go from a high dopamine fix to all the way crashing to a low dopamine fix. Or we can't say, oh, we're going to just try to stimulate serotonin as much as we possibly can and try to build a binder. It's getting that point of saying, what's steady step into this? So that's been one of the big things that I've seen, and a lot of people's attitudes become really great. And this is just something that I noticed. Most docs that when they talk about depression and anxiety, they suffer from it as well, but they don't want to, what's the correct word? Express or show love toward it because they're like, oh yeah, I understand everything you're going to be talking about this because I suffer from it well, but I'm not doing anything for it. No, I'm proactively doing something about it. Like, I'm showing love where love needs to be needed. I'm showing that I actually care. You just like calling their first name, saying, hey, you look great today. I'm glad to see you. Being excited that they're actually coming to see you in your office and feeling very grateful for them as well. So with the mental stuff, it's definitely one of those, it's finding that common balance of how far can you go to that line and how far do you not cross that line as well? Because when you do cross that line, it can be a little bit of not setting a boundary towards yourself.
Right. Yeah, that's very important. Because coming from a very empathetic person like myself, I tend to absorb all the energy of others, and it doesn't matter whether it's good or bad. If you put me in any room, I can feel what the heck was going on at a very deep level. What are some of the common misconceptions that people may have with chiropractic and holistic care in general, do you think?
The common ones I think is that thinking is it's always going to be the one fix all onto this. They think, oh, I'll give you this miracle pill and you're going to be good for the rest of your life. That's not really the case. If we're being realistic, if you had 10 years of pain and you expect me to say, oh yeah, I'll get you better with one visit, that's just a failure of expectation and a failure of communication. I can get you better in a shorter time than what you're suffering, but at the same time, to expect to expect me to fix you in one visit, that ain't gonna happen onto this.
Oh man, how true is that? The easy fix society that we definitely live in these days, when you can call up Uber or you can call up Amazon, we get that instant gratification just immediately, or those dopamine hits that we get over the internet, social media, et cetera, that it's kind of hard to explain to people that, okay, well, if you want to get a strong, healthy body, well, you're going to have to make a few sacrifices there to get to that point. You're going to need to, you can't just do one workout and expect to look like Arnold Schwarzenegger, So the same thing goes with your nervous system, mental health, et cetera. It takes time and energy, to do so.
Oh yeah, and it just goes back to saying time will you will always heal in time. Time is the epicenter. But as you and I both know, we don't have much time on this planet. We have a certain amount of time. We're lucky to be talking right now. We're lucky to be living right now and be able to help as many people as we possibly can at this moment. Because God forbid something happens to us after we're done with this talk.
Right.
Because it's lives for granted. It just goes back to saying, would you rather be given $10 million right now or wake up the next day?
I would say I'd like to wake up.
Exactly. And that's what it comes down to. If you're able to wake up and we're able to get you better and better each and every single adjustment that we possibly have, guess what? Your life becomes 10 times more easier than it is saying, oh, here's adjustment. I'll see you in 6 months. Then you come back to me saying, Doc, it didn't hold up. I'm like, yeah, I told you it wasn't going to hold up. I told you I was going to need to see you multiple times on this before we get everything, because feeling good and being stable are two different things. I am happy that you feel good, but we need to work on stability onto that point, because the body will always adapt to a non-functioning area before pain arises. When pain arises, that's the last flag before it says, you better do something. If not, we are going straight to the hospital. That's the biggest thing. So I always want to clarify, I am happy that you're doing okay. I am happy that you're able to play with your kids. But I'm still going to need to see you for a little bit of time to make sure you're staying stable, so you're still able to enjoy your time with your kids. You're still able to enjoy your hobbies.
Yeah, very well said. It's just because you're doing great and feeling great doesn't mean that there's not something underlying going on underneath the surface. And it's wonderful. Yeah, you're doing great, but you can do better. We can all do better. And I think with the spine especially, we can do a lot better, and myself included. What are like some decent, especially with the computer in this day and age and hunching over, sitting all the time, what are just some basic habits that we can do to improve our spinal health at home?
So with spinal health at home and being in front of the computer, being in front of your phone, the TV, such and such, the biggest thing is try and make it to a game. Let's just take like, if you're working on the computer and you're sitting down and it's an 8-hour shift, every 30 to 40 minutes, get up, walk around for 5 minutes, come back and do your work. So one, it presets and let yourself come back into mode to do more, to get your production done. And 5, it lets you to get away from all the gadgets and gizmos and bells and whistles that you have in front of your mind, so you're able to reconstruct and go back into it. Now, does that work for everybody? Not necessarily, but it's always a recommendation that I make for those who are computer workers or desk workers onto that point. And most people do that when they say, yeah, I need to start doing that. It's like, good, I'm glad you're starting to do that. Then at home, if you are, so since now TV is now more streaming than anything else, it's like anytime that a ad comes on, just pause it, either walk into the kitchen walk back out, do short reps, do about maybe 10 air squats of 10 push-ups, do something to get your blood flowing. Don't let your blood flow and don't to just like settle onto there, because we need to keep everything active. Movement is always going to be the biggest key in health with that.
Absolutely. That's so true, because you see a lot of guys in their mid 90s and stuff, and what are they doing every day? They get outside and they're on construction, they're gardening, they're moving their body, because without movement, we just have, you know, we die, you know. I mean, we're all dying on a moment-to-moment basis. We're all, you know, moving closer towards our last time on this planet, but when you're not moving, that's just going to accelerate things completely. I'm curious about sleep. And there's been a lot of debate about sleep recently, and sleeping position more particularly. But coming from a spine guy like yourself, I would like to know, because I'm a back sleeper and I like to lay on my back. But I've been recently looking at things that have contradicted that, and it doesn't really make sense to me. So maybe you can give a little more information about the spine and what's going on there.
Okay, no problem. So if we are talking just basic biomechanics with the spine with sleep, your top two is either going to be on your back, like yourself and me, or on your side. That's going to be putting your back in the most neutral position as it possibly can to have itself rest and not get itself injured or feels like you got trampled over onto there. Laying on your stomach is one of those deals. It just becomes a more primitive type situation where you missed tummy time when you were a kid. You didn't. They had acceleration, some sorts that happen when you were young, and you love living like laying on your stomach. Laying on your stomach actually causes all your two major curves in your spine, in the neck, the upper back, and the lower back, to extend out. We don't want to do that, because now you're pressing. If we think of the spine as a book folding up and down, when you extend the book from the covers up going out onto there, you are putting pressure on the spine of the book onto there, and that's when you're going to have all those dents and wrinkles onto there.
So that's when you're laying down your stomach, it's kind of like a book with the pages open, like laying down almost.
Yep, with the pages laying face down, and you're seeing the cover in the back cover of it. So, and what's that doing is that you're constricting, you're crushing, you're impinging the nerves, the nerves that are coming out, the nerve roots that are embedded into the capsule joints, bone on bone areas, all that interference, all that communication that's into there, you are pretty much just going into there. While laying on your back and your side, you're staying at a nice even pace onto there. You're not setting yourself in hyperextension. You're setting yourself in neutral.
Got it. Okay. What about with the neck? Because I think I have too many pillows and stuff like that, and so like my neck tends to kind of get a little achy. I'm wondering what's going on there.
So usually, I always sleep with one pillow.
Like that's a fluffy pillow, or
no, just a standard pillow onto there. I always sleep with one. I have 3 that are on rotation, so I rotate every week, every 3 weeks I have. So, and I just keep myself as flat as possible, because the biggest thing is that some of us can sleep without a pillow, but most of us need a pillow to sleep. It's one of those things that most people are like, well, I'm always used to sleeping a little bit upwards. Like, that's perfectly fine. But at the same time, your body's still automatically awake, because if you're standing up, I mean, if you're sitting up and you're one of those Tempur-Pedic folders or zero gravity beds, your body still presumes that you are awake while sitting up.
Wow, that's really interesting.
Yep, because the biggest thing is that you're not giving your heart a break. When you're laying down flat, you're giving your heart a chance to relax. I think it's like about maybe 60 to 40% of relaxation for your heart. So it's actually keeping everything nice and flow, and it doesn't have to work as much.
So essentially, think of yourself more in like a straight line when you're sleeping than like having like different high pillows or high legs or things like that. Would be more appropriate.
Yep. And some people definitely, if I know those who come in for low back pain, I always say if you sleep on your back, I always recommend saying get a couple pillows, put them onto your knees so you're not stretching the tissues, the back too much onto there. Is it going to be uncomfortable, or are you going to get a little bit at ease? Yes, but it's going to be better than nothing onto this.
Okay. And what does it as you mentioned a little bit about the Tempur-Pedics, so bed firmness probably plays a role into that. Would I be correct in assuming that a firmer bed would be better for the biomechanics of the spine?
To be honest, it just depends on the patient. Everyone's going to be different. No, like to be comparable with each and everyone's tissue, that's very hard to do. So it really dictates about what the bed is, what's going on. If the patient already knows, we'll just use a couple for example. A couple, if the wife likes to have a soft bed, but the husband likes to have a firm bed, you're going to have a soft bed. Let's be honest. The wife's going to say, "We're having a soft bed. I don't want to."
That's his fact. Yeah, that is fact.
So, but at the same time, it's causing the husband to adapt onto there. So now he's developing new tissues to say, "Oh, this is more soft." So now it's very confused. Now it's adapting to those. So it's either going to say, "Okay, we're going to do fine on this," or we're going to have trouble with this. And it's just a matter of like getting the feels for what we have. And that's the big thing. That's like you have to make the decision of what you want to have. I can't be saying like, "Oh, you need to go out and get a firm mattress. You need to go get the best neck pillow onto this." Right. I can only guess about what you can and can't do onto that point. Because face it, most beds are regulated to be with us for about 9 or 10 years, I believe. And not to mention they do cost a little bit of dollar. So not like you can go out to the next mattress place saying, "Oh yeah, I need this and that onto this and need to hear pronto," and figure out everything else at that point. It's just figuring out how can we get everything the same.
Right. Do the best for you that you can do.
Exactly. And sometimes I tell those, so with the husband that needs a firmer bed, I just say, "Hey, if you can, get a stiffer blanket and set that on your side." So now that stiffer blanket's able to flow down, it doesn't have it creates tension that the softer bed does not fully form onto that point, and you won't have any more problems.
Interesting. When it comes to the spine and flexibility, I think a lot of people associate the spine with something stiff and immobile, right? Mm-hmm. But when it comes to like flexibility, how we can improve our spine on a day-to-day basis through flexibility, or like make it stronger or things like that?
Oh yeah, absolutely. I just had a discussion with one of my patients. He's a big weightlifter. And he's had low back issues since he was 18, 19 years old. I just asked him, "So do you wear a belt all the time when you squat and deadlift?" And he said, "Yeah." Mm-hmm. And I said, "Why do you do that?" And he says, "It just feels comfortable and I can lift heavy." I said, "Have you ever thought of building your own back brace, AKA getting your muscles, getting your core, getting your back muscles, your biomechanics all intact onto that point. He said, oh yeah, I've tried that, but it just takes too long to do. I'm like, yeah, because you've overlooked, you just shut everything off and you hope to God that the belt's going to hold on, and then you just go through everything onto that point. So building your own back brace, especially through your core, is essential to everybody, because we are trying to, the core is not just the front. The core is everything. It is sides, it is the back. There's a reason why we call back abs for another term in the gym world.
Like lower back, or like lower to mid back, midsection?
About that lower, underneath the ribs to down. That should be like that should be a strong wall of core muscles.
That makes total sense too, because like with the body, if that's literally the middle of you, the midsection, and if anything else, if it's the mid area is some of the most important areas that we got. What about like flexibility with the neck, because that can get kind of tricky. I think I've got a pretty stiff neck, to be quite frank with you. Or just like a few exercises to do that can improve the mobility.
Yeah. So to give, I'm just going to go real quick. So the neck is one of the areas where it can move in 3 directions. What I mean by 3 directions, it can go flexion, extension, lateral, turn onto that point. It's the same mechanism that your shoulder and your hips play the same role onto that point. So it's one of those big movers that if it does not get correct motions, one of those areas will seize up, and we have to work on getting that controlled onto there. So most stretches that I like to say is if you have trouble with raising your chin above head, you're going to pretty much do chin tucks and get that neck to extend. So most people will probably hear a little bit of clicking or something rubbing in the back of your neck. That means we got some scaling muscles back there that have been so taut that they're rubbing against the vertebrae onto that point. So just working on doing this motion, it's going to help out. Then another one I like to do is these lateral movements. The lateral movements are a very, very cause and effective things, because when you turn your head automatically is going to laterally flex, then rotate, instead of just going all the way back, rotation. So what I like to do is saying, put your hand on top of your head, tilt your hand down, then put your chin down to your armpit, then do about maybe a 10% press and stretch this area and hold this for about 10 seconds. Then when you slowly release out of it, you're going to relax for 10 seconds, and you're going to repeat that every time. Then you're going to check and see, is that where my chin's getting to next?
Okay, thank you for that. And we're almost out of time here, but last thing I wanted to kind of dive into real quickly was maybe most people don't correlate addiction with like spine health, but I believe there is like a correlation to back again to anxiety, stress, addiction, things like that, insomnia. Have you ever seen people release a lot of emotions? I'm sure you have, through chiropractic care, like intense emotions.
Yep. One of my first patients I had opening up, she thought everyone was calling her crazy. She thought everyone was out to get her. Well, I mean, and that she was in such a distress, trauma state, she didn't know what was true or what was false. It took someone to listen to her to understand what's going on, to say, hey, I have you. We're going to get you better. And I'd like to go a little bit more into her, but at the same time, it's just patient confidentiality. Maybe on a different time, we'll go a little bit more into this patient. Sure. But at the same time, it just took one time, and she said, I've been holding so much stress and animosity and just a bunch of emotions that she just rattled off that she's never thought she'd be able to correlate them. So the very first visit, we had an emotional visit, and that's how we made our one-on-one connection. So she ended up crying. She ended up telling me everything that happened to her. A lot of stuff that was from her childhood that just kept on repeating back through her life.
Mm-hmm.
That caused her to experiment with drugs, become a drug addict, then the drugs didn't work, become an alcoholic, then self-medication because of what was going on. And she just needs somebody to listen and like saying, I got you, we're gonna make you better. So seeing the addiction, the trauma, because I firmly believe addiction has to start with some type of trauma. Mm-hmm. You just don't go say, I'm going to be an alcoholic. Mm-hmm. There's got to be something that triggered you to be an alcoholic to that point.
Yeah.
Onto there. So it's like figuring out what happened when you were young that brought you up into this.
So many great points. The one thing that comes to my mind is the average patient visit is only on 8 minutes for a doctor and a patient, and hopefully throughout time we can change that number to a higher number where you can make an emotional connection with your patients. But Dr. Andrew, thank you so much for coming on. It was awesome to have you on. I learned tons. Where can the people that are listening reach out and find you?
Okay. I am in Gladstone, Missouri. My practice is Wagner Chiropractic. You can follow me at Wagner Chiropractic on Facebook, Dr. Drew Wagner on Instagram, and Wagner Chiropractic on Instagram as well.
Wonderful. Definitely do that, guys. He's a great source of knowledge. And thank you for coming on. Take care.
You do the same, bro. Thank you very much.
Alrighty.